مساعد مدير التحرير في رويترز بريكنج فيوز السيد أندرو كريتشلو.
Ladies and gentlemen, Associate Editor, Reuters Breaking Views, Mr. Andrew Critchlow.
Ladies and gentlemen, Your Excellencies, thank you very much for being here today at this excellent forum. I'm delighted to have the opportunity to present this panel because I think that it really does tackle one of the most important issues, not just facing Saudi Arabia, but facing the entire region. We're here to discuss healthcare and what technologies will transform healthcare for developing countries. But of course, we all know that Saudi Arabia is no longer a developing country, and certainly the medical problems and healthcare issues that affect this region are not the ones that you would associate with the developing world. You know, they are very much first world, developed world medical conditions that are facing populations in this region. Now, since it was done, I've always been confused at why His Excellency Khalid Al-Fali, who we heard earlier, was named the Health Minister and the Chairman of Saudi Aramco. It seems very odd to have such an accomplished and experienced oil man at the head of your most important oil medical institution as the head of the health ministry here. But then when I looked into some of the problems that face healthcare in Saudi Arabia and the money involved, I kind of realized why. Diabetes is a huge issue, not just in Saudi Arabia, but across the entire region. And based on some WHO figures that I dug out, at least 19% of the Saudi population, are at risk of diabetes. Now, if you break that down into money terms, based on an average cost of $3,800 per person per year to treat a diabetic in the kingdom, that works out at a total spend of $18.7 billion a year. Now, let's put that in oil terms. For Saudi Aramco to produce enough oil to pay for that's at current market prices of $30 a barrel, 623 million barrels of oil, which is 62 days of Saudi's current oil supply. So I think that puts the problems facing healthcare in this region really into sharp focus. I'd like to introduce my panel. We've got some real experts and authorities, not just in global healthcare here, but also on the healthcare issues facing Saudi Arabia. First, I'd like to go to Dr. Basmah AlBuhairan, Managing Director of Healthcare and Life Sciences at SAGIA. Then Mr. Suresh Kumar, Executive Vice President of External Affairs at Sanofi, one of the top 3 pharma companies in the world. Jonathan Fleming, at the end there, President and Treasurer of Network for Excellence in Healthcare Innovation, which is a US-based think tank. And finally, Mr. Stephen Thompson, Senior Vice President, Chief Business Development Officer at Brigham and Women's Healthcare, which is an affiliate of Harvard, one of the most esteemed medical institutions in the world. First, Dr. Basmah, I mean, if you could just set the scene in terms of Saudi Arabia and the challenges, but also what you're hoping to achieve at SAGIA in terms of addressing these challenges.
Thank you. Bismillah ar-Rahman ar-Rahim. Good morning, everyone. So I think I'd like to start by first talking about some of the progress that Saudi Arabia has made within the healthcare system in recent years. So Saudi Arabia has made significant strides and advances in improving the healthcare of its citizens over the past 2 decades. So at a macro level, if we think about life expectancy has increased from 42 years of age from 1950 to 76 years of age in 2014. Infant mortality rate has declined from 52 deaths per 1,000 in 1990 to 17 deaths per 1,000 today. Our healthcare expenditure is around 5% of our GDP, which is amongst the highest within the region. Over the past 7 years, we have more than 9 million people who have become insured. The country has also seen increased access to healthcare healthcare professionals. So for instance, if we just look at the rate of physicians from 1990 to 2014 went from 1.5 physicians per 1,000 to 2.2 physicians per 1,000. So while we are by no means best in class, especially when we are benchmarked against the developed economies in the West, we are actually heading in the right direction. So yes, there has been cuts in healthcare expenditure. It has been reduced to 35% this year. However, I am very optimistic that the reduced healthcare expenditure will open up and provide opportunities for the private sector, because we do have challenges, and these challenges, I believe, are opportunities. So one of our challenges is we are a large population, a population of about 30 million, which has been growing quite significantly, although population growth rate has reduced in recent years. If we talk about non-communicable diseases, NCDs, diseases of affluence, which they're also known as, we are not the only country that's afflicted with NCDs. This is a very unique, this is a global problem that many countries are also facing. If we take diabetes as an example, and you started to talk about diabetes in your opening statement, we have a population of more than 6.9 million who are diabetic. That's a prevalence of about 24%, which is quite high. If we talk about obesity, 1 out of every 3 adults and 1 out of every 8 children are obese. If we talk about cardiovascular diseases, we are the second highest prevalence for cardiovascular disease at about 26.1%. We also have a population that will be aging. Out of the 30 million population that we have, about 800,000 are over the age of 65 years. In 2020, that population is anticipated to reach 1.3 million. Now, the medical cost for a 65-year-old is up to 16 times that of the average for the entire population. So we do have some challenges. But as I said earlier, these challenges are opportunities. So what are we doing about that? How do we plan to address these challenges and turn them into attractive opportunities? So the Ministry of Health is undergoing a healthcare transformation. And so we at SAGIA are actually working hand in hand with the Ministry of Health to help to support them in meeting the challenges to deliver a healthcare system for tomorrow. And the healthcare investment plan has identified more than 40 opportunities that span across the complete spectrum of healthcare, from medical devices to pharmaceuticals to services to education, worth of about 41 billion Saudi riyals over a period of 5 years. And so the healthcare investment plan is actually part of the National Investment Plan, which is part of the National Transformation Plan. And so we expect that the private sector will be engaged, and the Ministry of Health plans on actively engaging with the private sector in providing sort of new models of healthcare delivery. So currently, the way our healthcare system is set up, about 79 to 80% is provided by the public sector, and that includes the Ministry of Health and the other government facilities. And about 21% is provided by the private sector. So I believe that the share of the private sector is going to increase significantly and dramatically. And so one of the things that we will be looking into is we'll be looking at, if we talk about diabetes, again, or just NCDs in general, we will be focusing on preventive medicine, preventive care, and looking at how technology could be an enabler to that. We will also be looking at moving away from the traditional models of care, so moving away from acute care, episodic care, inpatient care, to more of your ambulatory wellness sort of services, prevention sort of services, mobile clinics. So that's what we're going to be really looking at. And the aim of the healthcare investment plan, it's really to accelerate the development of the healthcare sector, as well as increase the capacity of the existing healthcare system, and to also look at innovative models for delivering healthcare.
So it seems very much a case in Saudi Arabia, and I'm sure this is the case elsewhere in the region, but having to do more with less, and having to deal with these very much first world medical problems like diabetes. I mean, if I could go to you, Jonathan, I mean, from the American experience of dealing with some of these issues in a healthcare environment, obviously innovation and technology is playing a dramatic role in changing how we approach treating some of these conditions. But what have you learned in the US that is maybe applicable here in Saudi Arabia?
I think the thing that we've learned in the United States, particularly with the care of patients with diabetes, is that technology by itself is not the answer. That you're really dealing with very complex human behaviors, and that you need to have a healthcare system that goes into the community, that goes into the home, and works with the family, works with the community to implement better healthcare behavior and to interact with the healthcare system in a more positive way. So a phone app by itself is not going to solve your problem of diabetes. A healthcare worker who goes into a community who has access to information or who can communicate information about a patient to the system using technology is a good use of technology. But technology by itself, a new drug, a new app, a new test, is not going to solve this problem. You really have to get down to the fundamental behavior of these patients. Diabetes is principally a disease which is caused by behavior. And if you can change the behavior, you can treat the disease much more effectively than if you were to use a drug or a piece of technology to do so. If you're showing up in a hospital with type 2 diabetes, or if you have to go onto the medications, you've already progressed to the point where you're going to be costing a lot of money to the healthcare system, and your health is already at risk. A good healthcare system will try to prevent that.
I think that so many of these, as you just discussed, we can see so many of these kind of first world illnesses like obesity coming. We can, we have technology that will tell you you've got high cholesterol, you've got high blood sugar. I mean, I guess my question to you, Stephen, is why are we ignoring it, and why are people here in Saudi Arabia ignoring it, perhaps?
Why are we ignoring it?
Yes.
Yeah, well, I don't think we're ignoring it. I think what we're doing is trying to figure out how to use technology to improve the outcomes. I agree with the shortcomings of technology as it's currently used, but recently I was with an executive of Qualcomm who indicated that more people have access to the mobile network than have access to the electric grid, to clean water, or even own a toothbrush globally. So that just speaks to the strength and the opportunity that mobile health can have. And one of the things that we have to combat is a healthcare system largely that is very asymmetric with respect to knowledge and information. We need to get more information, more knowledge into the hands of patients and their families in order to make an impact. I think that speaking to diabetes specifically, it is a disease of behaviors, and as we know, and just to reiterate, that it's hard to imagine how much a phone can change behavior, but I think that coupled with health system design, technology can and will make a difference.
Suresh, if I can come to you, I mean, from your perspective, what technologies really are making a difference, in practical terms, and what technologies specifically can work in the Saudi context?
There's several ways to look at it. I'm not going to bore you with more facts, but some facts are necessary. The facts are compelling. The progress is palpable in Saudi and elsewhere. But our entire healthcare system the world over was really designed for acute care. And yet, in the last 15 minutes, we've spoken to diabetes. 57 million people die every year. Of those, 38 million, a full 68%, die of non-communicable disease. 1.5 million of those are diabetics. Between now and 2030, those will move from 1.5 million deaths for diabetes alone to 2.5 million. But diabetes has significant amount of comorbidities. Cardiovascular disease, hypertension, renal disease, amputation, blindness. If you add all those, it's a significant portion of deaths. In the Saudi context, 31 million people, 23%, 24% have diabetes. Unfortunately, acute care epidemics get headlines, but it's non-communicable disease and diabetes which break the bank. The solution is not 103,000 apps on a telephone. That's the number of apps related to healthcare, which is available today on a mobile basis. The solution is integrated care. Integrated care where the data captured by any form where data is collected speaks to each other. So let me give you an example with diabetes since we've gone there. Clinical tests. Clinical tests which are done have a range of data. People go and buy products, including drugs, at a pharmacy. That captures data. Claims data is available with the payers. Behavioral data can be captured if it's clean and scrubbed data on a telephone. And unless all these data capture comes together in an interoperable manner, technology is not a solution. Let me give you a couple of quick examples on technology. The basis of technology being used for healthcare is predictability and no variability in data capture. Today, the practice of medicine is still more an art than exactly a science. There is no standard operating process or a standard of care. If you look at it on a 6 Sigma basis, barring anesthesiologists who are close to 5.95 Sigma in the US, most medical specialties are approximately at 3 Sigma. That is lower than 4.3, which is the operating efficiency of baggage handlers at airports. Ladies and gentlemen, if you got your bags yesterday, it's a miracle. But science of medicine, the way it's practiced, procedures, delivers less. I think we need to move this conversation to things what can certainly help Saudi or the Middle East, or indeed the rest of the world. The fact is, 2% of the doctors of the world reside in Africa. They're not going to provide all the solutions. The fact is, Saudi needs more doctors, or how healthcare is delivered. That's where you use technology. The manner in how to train people, the manner in how to train your surgeons. I saw a facility, to give you one example, in the University of Southern Florida, which trains surgeons. People come here, they operate on a mannequin. Every incision is captured. How long it takes you to make a procedure is noted. How you call for medicines and interlinked is captured. And all that is in real time or longitudinally conveyed to the doctors. As Saudi puts its own infrastructure together and the competencies of its people, it is using such technologies at scale, which is going to be critical, as is going to be telemedicine, to deliver healthcare where patients reside. You heard one of the earlier speakers speak about ambulatory care. If you expect patients to come to hospitals, that's not going to lead to compliance. For those of you who are diabetic, if you travel, you need to take a laptop, an iPhone, an iPad, possibly your diabetes meter, and each one of them with different plugs and chargers. You probably need another suitcase. If you are not going to simplify this through interoperability and convenience, compliance will not follow.
I mean, how much of that, Dr. Basmah, is applicable here? I mean, in terms of the digitization of medical records in Saudi Arabia, I mean, how much are these medical records talking to each other? Also, in Saudi Arabia, it's a very private society, large extended families that tend to probably keep, medical issues internalized. How much of a challenge is it actually getting people in Saudi Arabia to go and see a doctor, to go and give this information that can actually, when extrapolated out across millions, save a lot of lives?
So I think, we do have very successful stories of successful hospital information systems. So to cite 2 examples, King Faisal Specialist Hospital and Research Center adopted HIMSS Level 7, and it's the only hospital outside of North America and that has actually achieved HIMSS Level 7, and this was either in 2014 or 2015. And they received HIMSS Level 7 for their ambulatory electronic module adoption. If we take the example of the Ministry of National Guard Health Affairs, for instance, they also have sophisticated hospital information systems. If we also have sophisticated radiology systems, and those could be leveraged to provide care. I agree with what was earlier said. It's not just a matter of technology. Technology is an enabler, and you need to be very smart about the investments that you make in technology. Yes, we hear about apps, we hear about wearables, Fitbits, remote monitoring devices, you name it, it's out there. It's just how the movement has moved in technology quite fast, and it's being adopted now into healthcare. But we need to be very smart about where we make our investments. So I believe it's a combination of the model of care. We need to look at providing care to the patient, improving the patient experience. It should be about the patient, and it shouldn't be about the healthcare providers. And I think we spend too much time as healthcare providers thinking about what's good for me as a physician or as an allied healthcare worker, and we forget about that poor, suffering patient. So it's a combination of technology and the patient. If we think about people who live in remote areas in this country, we do have access challenges to healthcare. We have challenges associated with equity as well to healthcare. And so people who live in remote areas, and the way the culture is in this country, it's not the patient who travels by him or herself. The patient will come with family members. So just imagine, a group of family members having to travel from Hayel, for instance, in the north, to Riyadh. So if you think about the cost that you're burdening on the system, not just in terms of financial costs, but more importantly, the psychosocial cost that patient has to bear along with the entire family, and then they come to Riyadh, they have their medical appointment, receive medical treatment, so they might spend here, a couple days, and then they might have to go back, and then they need to come back for further follow-ups. So things like that can be eliminated or alleviated as much as possible by using telemedicine, for instance, or even using telehealth. So it's a combination, I think, of looking at both sides of the equation and trying to balance things out.
Is that being offered in Saudi Arabia at the moment? I mean, are there any companies offering telemedicine, mobile clinics that are traveling around the kingdom into remote areas?
So we have some, as far as I'm aware, I haven't come across any mobile clinics going to remote areas. But if we take mobile health, for example, yes, there are so many apps that are out there. But if we think about mobile penetration in this country, we enjoy ranking at number 9. And so we have a very huge penetration, 170%. So mobile health is I don't think will be a very difficult thing to implement. And already right now, there are certain hospitals where you can actually book your appointments online, you can cancel your appointments, you can prescribe medication, ask for refills. So there is digitization, and we are I think we're lucky in a sense that although we've entered the digital era quite late, not as early as Western countries, but we don't have the legacy systems that we would need to deal with, where you would need to migrate, and that would cost an enormous amount of money, and you would need to rebuild all of your infrastructure. You asked me earlier if do we have a unified medical record system? Is the medical record is it connected for patients? No, we don't. However, about 2 weeks ago, His Excellency the Minister of Health announced a significant agreement with a technology provider that will be responsible for delivering the National eHealth platform program, and they will create the infrastructure. So once that's ready, we will be improving quality and efficiency of services, and information will be electronically exchanged in an efficient and in an effective manner.
I mean, can you quantify that at all, Stephen, in terms of what difference that actually makes to healthcare, in terms of this will reduce your budget by 5% or it will extend life expectancies by 5%?
So to respond to that last point, or use that as an example, I think that going back to what drives the minister's plan to create an integrated system, currently even the best installations of electronic medical records are largely institution-based rather than individually oriented beyond that. So there's a huge economic benefit to have these huge databases that sit behind electronic medical records to be able to connect to each other for my specific information. Because without that, the cost mounts very rapidly. Tests are repeated, diagnoses are often inconclusive. I think it leads to a tremendous amount of waste. So having the most current information available at the time of whatever encounter is occurring, whether it's with a community health worker, an ambulatory or day facility, or even an acute care, having that information will drastically reduce the amount of waste and excessive testing and other things that contribute to cost.
Some people in the West advocate that there should be blanket DNA profiling to give medical professionals a heads up that there are conditions like diabetes that people should be aware of. Now, you're quite skeptical about this, Jonathan. Why?
Well, again, the whole idea behind a DNA test is that with this information, you will change your behavior. And what we've already talked about for most of this panel is just how difficult it is for patients to truly change their behavior. And what we have really discovered in the United States, my think tank is doing a project in diabetes right now, in part sponsored by Suresh from Sanofi. And what we've discovered is that even if you have wired up all of the patients, and you've wired up all of the hospitals, and you've wired up the doctors, that's not actually what makes the difference. And that the project is actually revealing that unless there's an individual, it's not a piece of technology, it's actually a human being, that coordinates the care of the patient and really works with the patient in their family or in their community, and takes this information from the various doctors. Remember that a patient with diabetes is almost certainly going to be seeing an endocrinologist. Because of the comorbidities that Stephen mentioned, they're probably going to be seeing a cardiologist. They have a primary care physician. They have lab tests that they have to undergo. They may be undergoing eye tests because of the damage to the eyes that they're receiving. So in all of these places in the healthcare system are likely to write a script for a pill. So a patient with diabetes might be testing themselves daily, injecting insulin, but also taking a number of pills. And it turns out that to get the benefits of technology, somebody has to coordinate this care. And that that somebody is a person. And it doesn't have to be a doctor, it can be a community health worker, it can be a member of the family, but almost certainly is probably going to be a member of the healthcare system. So we're actually advocating in the United States that the healthcare system actually have a reimbursement payment per person who's going to be known as the healthcare coach, which we think is actually going to be the key intervention that drives the improvement, at least of the cost and the outcomes of patients with diabetes in the United States.
I'd like to kind of throw it open to the floor here with a vote. If you had the opportunity to take a DNA test, and that DNA test told you that you were susceptible to certain medical conditions like diabetes, would you change your behavior as a consequence of that? If we can have a show of hands for yes.
What if we told you you had to cut down your sugar intake by 50%?
So that's quite startling. You know,
Which
that's
is
not
still
even
a-
half
still
the room.
is.
That's not even half the room would actually change their behaviour as a consequence of a DNA test. Now, I think full disclosure on this question. I actually had a DNA test a couple of years ago, and I didn't look at it for this very same reason. I didn't want to know what the answers were. And then at the beginning of last year, I did take a look at this DNA test, and it said you've got a higher chance that I'll develop diabetes. So I was about 100 kilograms in weight then. I had a cholesterol about 6.2. Now I weigh 85 kilograms, and much healthier. And you know, I think I've got a fair chance of seeing my son get past the age of 35. He's 11 now. So that's really interesting, and it seems to me from that your battle, Dr. Basmah, is actually about getting people to change behaviors. How do you do that? How can you invest to get people to change behaviors?
If I could comment, last week in Davos, we had the same conversation. A sugar tax was imposed in Mexico. They tested 1 full year before and 1 full year after. As a consequence of that, 23% of food manufacturers had cut down using ingredients because of the taxation. Second, a full quarter of the people started consuming fewer sugar. And the same thing is replicable. It is also done in Hungary. So behaviors can be modified, but what exactly are the cues are very local, and they need to be thought through. But I do want to pick up on something which you heard. I think we are sitting at tremendously exciting times in the world of science. Phenomenal. Last year alone, the FDA approved 45 new drugs, the highest since 1990. That's huge. And that's all because of DNA therapy, gene therapy, etc. This is not entirely new. We're just learning more. In the 1960s, we understood DNA. That led to the first industrial batch production of insulin, which is standard of care for the treatment of diabetes. In the 2000s, we understood DNA sequencing, which allowed us to manufacture and produce targeted medicine. And today, we know to read, edit, and modify genes. Now, the scary thought is, we know science can go and pick out that gene which has a disease, take it out, put something back so that it could lead to a cure. Now, there are other issues with technology. Should this data information be accessible to everyone? If I have my blood type in an EMR, could you go and change my blood type in my record? Those are cybersecurity related issues which we need to comprehend. But it's happening. And again, on technology, let me share, I represent, very fortunately, a company which is huge in diabetic care. We've announced a tie-up with Google. And the Google tie-up is a simple one. Think about the life of a diabetic if you were one. You get up in the morning, injecting yourself to test your blood. You do so 3 times over. Before you eat, you're planning what is it that you're going to eat and how many calories it should be, and therefore what's the insulin shot you need to give yourself. Then you got to remember to exercise, and you got to keep a log of how much you sleep. The patient is worn down. The Google exercise which we have, or the platform which we have now, which is in early stages, you wear sensors, very unobtrusive sensors, which monitors you 24/7 on a constant basis. It monitors your behaviors, your sleep patterns, your eating patterns, based on real time what your sugar level is, and based on the fact that multiple transmitters, multiple points of reading all come up with the same answer, you automatically get your insulin shot.
It seems what you're talking about, it's like a virtual hospital. I think that one of the problems is, though, that for the majority of people, and for health ministries and governments planning budgets, people think of healthcare in terms of hospitals. I mean, we've got a very good question here from the floor, and this is directed to you, Dr. AlBuhairan. I mean, you've mentioned hospitals in Saudi Arabia that have broken the boundaries, but the problem remains that these hospitals are not accessible to the average Saudi citizen. And the question is, how will Saudi help make these world-class hospitals in the kingdom more accessible to the Saudi public going forward?
So as I mentioned earlier, we do have issues associated with access and equity of care. But I think as now the Ministry of Health is moving towards a reform, a healthcare reform and transformation, and it will be engaging very actively with the private sector. And I think this is where the private sector can help in making hospitals work more efficiently and more effectively. So I believe it has to be that private-public partnership, and technology again, maybe in some instances, technology isn't being utilized efficiently, or the right technology may not be the one that's in place. So it'll be a combination of, there has to be some sort of process re-engineering along with some technology, along with actively engaging with the private sector.
Can you achieve your budget goals, though? I mean, you mentioned that the health budget's going to be cut by a third, and actually bring more healthcare closer to communities in the kingdom. And also, there is a cost associated with providing healthcare for pilgrims. Is this sustainable still in Saudi Arabia?
I think so, again, because we will be engaging with the private sector. I think if we were not going to engage with the private sector, then I may question that, sustainability or capability. But to engage, having that public-private partnership, and we heard His Excellency the Minister of Health earlier this morning mention that very briefly. So I believe if we bring patient care closer to the patient, and we focus on preventive care, focus on the wellness aspect, the primary health care, we need to redevelop our existing primary health care system. Costs of health care will go enormously down. We already know right now that the cost of a diabetic is enormously high, and that is not sustainable. So we need to fix the downstream issues now in order to prevent things from increasing and moving more upstream. And if we look at our population of 30 million, about 47% is under the age of 25. And type 2 diabetes is very high in this country. So we need to make sure that we have a very healthy population, a healthy nation for tomorrow.
Jonathan, if I can just come to you we have another question here from the floor, that how do you get people to invest in changing behaviours? Now, of course, one of the criticisms of the pharma industry is that it actually doesn't want to change behaviours because, it makes money out of...
No. Look, this is something you got to nip in the bud. We are trying to work ourselves out of a job because the common enemy of anyone in this room is disease. Disease knows no barriers. You posed a question, how will the cost come down? In the Veterans Administration in the United States, using 325,000 televisits, not doctor visits, televisits, Psychiatric admissions came down 24% in 2014. That's a fact. If you're talking about changing behaviors, everything we're talking about is modifying behaviors. Exercise, nutrition, sleep. This actually helps you control.
Jonathan, in practical terms, though, in the US, do you see Big Pharma investing enough to change people's behaviors?
I don't want to take on Big Pharma with Suresh in the room, but there are several ways that you can really change behaviors that are really interesting. So one of the interesting combination of behavioral psychology and technology is the ability to use gaming technology. So one way to get people to change their behavior or to take their pills is to create incentive schemes, typically around a game or a lottery or some interactive involvement with the patient where they are rewarded if in fact they behave differently. And there are a variety of examples of gaming technology starting to be used in this respect. But maybe the most important innovation was briefly mentioned. I just want to come back to it. One of the most famous hospital systems in the United States, certainly one of the biggest ones, and one that covers a population that's about equivalent to the entire Kingdom of Saudi Arabia, is the Kaiser Health System. And I recently attended a talk where they are tearing down their hospital buildings. They are bringing them down, and they're replacing them with clinics that are small, modular, easy to build, inexpensive to build, much more numerous, and out into the community. Because the way that you're going to change behavior is when someone comes and checks on you every week, and you want to sort of do your homework or do what you promised you would do for the visit of that person.
And do you think that Saudi Arabia needs to do that?
I absolutely think everybody needs to do that. That's not a Saudi problem.
If I could just go to the floor, I think we have a question from the audience. Do we at all?
Yes.
If I could just go to the lady over here, please.
Hi, my name is Tuba Tarekli. I'm the co-founder and CEO of Kutufa Riyadh, the Entrepreneurship Foundation. I have actually a question that is threefold. Number one, I think as a TED mentor and a chief of strategy that was first in healthcare in Saudi Arabia, I always saw reactive policies rather than proactive ones. We really do need to capture, and this is my question, how do you recommend we capture an early offset of education into dietary habits and healthcare habits from the school age? And cooperation between Ministry of Health and Ministry of Education is very needed. Today, our school cafeterias that serve all the way to postgraduate level in universities included, from K to postgraduate, do not serve a single healthy meal to our kids. We have to monitor what our kids eat. Instead of speaking about diabetes reaching 28%, we really need to take action now and today. I want to find out if we're doing anything about it. Second thing is on primary healthcare centers. I think we also need community healthcare centers, knowing Kaiser healthcare system very well and the reactions they've taken over the past 10 years. We have very highly educated patient population in Saudi Arabia. They are unable to reach proper treatment due to community health centers lack in all across the kingdom. If there is a plan to spread such centers, we want to find out about it. And the third point is on technology. Yes, you know, as a community that enjoys cloud-based healthcare systems in US, and I was one of the first people that did the 23andMe screening as well, I can tell you that in Saudi, many young entrepreneurs are very ready to do technologies in healthcare, including telemedicine. We had absolutely 5 applications to our accelerator in healthcare. Healthcare startups are costly. There isn't a single VC focused on healthcare startups. We don't have healthcare accelerators. And when we do go to the multinationals that earn billions in medicine and other products from Saudi Arabia as a base economy, they don't invest back in Saudi. We went to them for sponsorships, for any direct support for such startups. We didn't get any. So your actual recommendations as how can we get the multinationals making so much money out of Saudi Arabia contribute back into a system to develop the technologies based here in the base economies, through educating patients for their startups that they themselves can drive. Thank you.
Some very good questions there. I guess it's put you on the spot there, Dr. Basmah. I mean, the first one, education at primary level above in terms of just making healthy choices. You know, how much is done? How is the education ministry in Saudi Arabia talking to the health ministry on these issues? What more can be done? What are the goals? The primary community healthcare centres, I think we already addressed that, but it'd be good to get some figures on that. Where do you want to go? How many do you want to open? What's possible? And I think the final point is an excellent one. The final question, you know, is there a 23andMe indigenous to Saudi Arabia? Are there Saudi scientists out there, Saudi doctors who are doing this kind of innovative medicine?
So the answer to the first question, the school health program right now is under the Ministry of Health. It was recently moved over to the Ministry of Health several months ago, if I'm not mistaken. What is the Ministry of Health doing about that? I have no information, but I presume that they will be looking into that and making sure that the food that's provided at schools, the right sort of food, the right sort of nutrients, and that that students do get educated on healthy eating. With regards to the second question about community centers, I don't have figures for you to share with you. How many community centers would be built and where. We haven't gotten into those discussions, but what I can tell you is, as part of the healthcare transformation plan, we are looking at introducing different models of care. With regards to the last question about the multinationals investing, so part of my role at SAGIA is to expand the development of the healthcare sector. So I have started to actually communicate with these multinationals, including Sanofi, to get them to invest into the value chains that will make a difference for us and where we will see value. And one of the
Because on that point, countries like Australia, for example, has done particularly well in getting large pharmaceutical companies to open up R&D and to develop medicines actually in Australia. That's not happening in Saudi Arabia.
So just to be very clear, there's a significant amount of investments. Let me line them somewhat. With the Ministry of Health, because of the issue of diabetes, Sanofi sponsors epidemiological clinical studies specifically to Saudi population in Saudi Arabia. Second, we are here to stay. We are amongst the oldest pharmaceutical companies, and we have a joint venture. We don't import into this country, have been here, and we have manufacturing facilities here. So these are investments. Disease knows no barriers or boundaries. Disease goes everywhere. We are here to stay, and you have to work with the local countries to know and understand disease better. The question was even beyond that. Can you get into DNA type, gene testing type? That's up to the entrepreneurs in Saudi to decide. But if anyone has an idea on delivering better healthcare and how we can be a part of the solution beyond pills, we are there.
So quite clearly, there's a lot of opportunities there for investors, international investors in this sector in Saudi Arabia, and a lot of work for SAGIA to do going forward. I would like to thank all our panelists today. That's been a fantastic conversation about what I really do believe is the most important issue facing Saudi Arabia at the moment and the wider region, and that is the health of people in this part of the world. Just before we break for the next breakout sessions, just a little bit of housekeeping for everyone. We'll now move to the Invest Saudi exhibition area, where we've got 3 workshops. Space is limited, so it's on a first-come, first-served basis. And could I ask everyone to leave the plenary hall so we can set up for lunch? Thank you so much for your time. Thank you for your questions. And I wish you all a very good 2 days for the rest of the conference. Thank you.